سلام و برنامه پل خوش آمدید.
Good evening and welcome to Pull. The death rate among Afghan women during or following childbirth is believed to be among the highest in the world. In fact, the maternal death rate in Badakshan province is the highest ever recorded in human history. Equally shocking is the high infant mortality rate in Afghanistan.
همچنان مرگ و میر بیش از حد مواسنه نوزادان در افغانستان نیز تکان دهنده می باشد. امشب
Tonight, we'll talk with U.S. government officials who have worked on the ground in Afghanistan to improve maternal health care. And we'll learn about the U.S. Department of Defense's effort to assist the growth of Afghanistan's healthcare system.
از فعالیت‌های و خدمات‌های وزارت دفاع ایالات متحده در امور صحی زنان در افغانستان خواهیم آموخت. Dr. Patrick
Laraby is a commander in the Department of Defense International Health Division, a team of experts in developing the U.S. military's medical policies around the world.
همچنان Dr. Brian McCarthy
And Dr. Brian McCarthy leads the Center for Disease Control's Afghanistan Health Initiative, working to improve healthcare at the Rabia Balki Maternity Hospital in Kabul.
رابیه بلخی در کابل می باشند. Dr. Lynn Lawry
Dr. Lynn Lawry served as the director of the Initiative on Global Women's Health and worked in Afghanistan as a senior medical researcher for Physicians for Human Rights. She is currently the Senior Health Stability Specialist with the Defense Department's International Health Division.
در وزارت دفاع ایالات متحده در بخش صحت بین‌المللی کار می‌کنند. خوش آمدید. Thank you for coming to the show today. I want to start with you, Commander Laraby. I want to ask what the DoD's activities are with respect to the health sector in Afghanistan.
Sure. Thanks, Miriam. It's a very important question and has been a source of confusion as of late because of the Department of Defense, which is really what we call the military here in this country, and because of our size and presence in Afghanistan. The role of the Department of Defense, or the role of the military in Afghanistan, is really a very supportive role. We are there to really mentor the Afghan National Army and the Afghan National Police with their physicians, their nurses, their medical technicians to better take care of the Afghan soldiers and the Afghan police as well as their beneficiaries or their families.
So is there training taking place where military doctors are training Afghan physicians who are the doctors to the Afghan?
Yes, Miriam, very much so. There's some very large programs going on in many places throughout the country where American physicians and American nurses and American medical technicians are working with their counterparts to teach the Afghans how to best take care of their own people and to really what we like to call build capacity within the Afghan health sector.
Dr. McCarthy, can you tell us a little bit about the Rabia Balkhi Hospital? There were some problems with respect to the training at one point, and there were some criticisms of the program. Do you think those have been addressed now?
Oh, I think they've been fully addressed. When you walk into an environment such as this, where the challenges are enormous, you hope to do the things correctly the first time. Sometimes you have to alter your strategy, and I think that that's what has been done. There's been some very good mid-course correction of what we're doing, and I think that we're well on our way to providing a means to support the Ministry of Public Health and to develop a program at RBH that the Afghans can be very proud of.
Dr. Lawry, having worked with NGOs on the ground in Afghanistan from about 1999, you have, prior to the DoD, a long time of experience. What have you seen with respect to the capacity of the Afghan nation to provide health care for its citizens? Has there been some points where it was better than it is now, or have you seen things improve?
Many years of being there has shown me that things have improved significantly. I'll give you one example. The Ministry of Health has huge capacity, and I work in many other places besides Afghanistan. If you look at the policy documents that the Ministry of Health has put out, there's 11 or more, all of them with successive changes as they accomplish their goals and then move on. This is not the case in many countries, so there is huge capacity within Afghanistan, and there always was. Even during Taliban years, the civil society was running, and it was running by Afghans, for Afghans, but you have seen that things have changed. I mean, although the security fluctuates and NGOs can't always get to the places that they need to be to do the work, there are, I think, stepwise, and sometimes in the NGO community we call this baby steps, where you take 2 steps forward and you fall 1, but you've only lost 1. There are changes that have occurred, and I think just looking at the Ministry of Public Health and the number of documents that they've come forward and completed with the help of USAID and State Department and NGOs, I think that's huge.
You touched upon security. I want to ask Commander Laraby, how do you think the security situation affects the ability of, the NGO world and Afghan government to provide health care?
Well, sure. Certainly, providing health care is much easier in a very secure environment. And the less secure the environment, the more difficult it is to render health care or to mentor our Afghan partners in rendering health care for their populace, if you will. So the more insecure an area is, or the less secure an area is, the more difficult that is. But the whole reason the Department of Defense exists is to operate in less than secure areas. If it was a completely secure environment, as is other parts of the world, the Department of Defense would not be present at all, and it would be all of our interagency partners really doing 100% of the effort.
So I guess the Department of Defense has an indirect role in hopefully providing some security so that the NGOs can come in and do the humanitarian
Absolutely,
work.
as well as mentoring the Afghan National Police and the Afghan National Army to create a more secure environment for Afghanistan, and therefore allow them to deliver better health care.
Under the circumstances, the only reason we can be there is because they're there.
Yes.
And health is also security. It's not just that you need security for health, but health also creates security. And so that is a focus that needs to be addressed.
Definitely.
More from our guests on maternal health and childcare when we return.
بعد از یک وقفه کوتاه.
Continuing our conversation with Doctors Anderson, Lawry, and McCarthy.
I want to turn to a very important topic for Afghanistan, given the really high mortality rates, both for mothers and children. What have been the leading causes of child mortality in Afghanistan?
Well, child mortality, the vaccine-preventable diseases, diarrheal diseases, the diseases associated with acute respiratory infection, have been the leading causes of child mortality. What we have been mainly focusing on would be neonatal or newborn mortality, which has also been very, very high.
What has your center found to be the leading cause of such infants' deaths?
Asphyxia, in other infectious diseases. We believe that there are problems with malaria as well in certain times of the year. Some of the vaccine-preventable diseases in which there has not been the availability and the access to that programs are also contributing to that.
What role do you think midwives really play in a society like Afghanistan where you don't have enough doctors and nurses? Did you see with the presence of skilled dais an impact from their work?
When I was with Physicians for Human Rights, we looked at maternal mortality in Herat. And what was interesting was that Herat, which has a maternal hospital, 99% of the women in the entire province delivered either alone or with a traditional birth attendant. So these are women who are integrated in society. They are generally untrained. And so one of the things that was started, particularly with the Ministry of Public Health, was to actually do training programs with these doye. I always pronounce it wrong, I'm sure. And also community health workers to be able to meet the needs of these women who are going to deliver with these women regardless of whether there's a hospital there or not.
How do you think that Afghan women could access these skilled workers if they wanted to?
That's even a harder question, and I think that Dr. McCarthy would agree with me that you can train them in Kabul or in Herat or in Mazar-Sharif, but to get them to the rural areas where most of this is happening is much harder. And so there has to be either coming up with programs with incentives so that they will go out into the periphery, and also making sure that there are women that are trained as these skilled providers to do this.
Midwives are the backbone of any maternal and newborn health service. and the availability and accessibility and sometimes the acceptability of the environment in which they'll practice and how they practice, and the type of supportive system that needs to be behind them is an important issue that we're trying to address.
Sometimes some of the health problems in Afghanistan can be addressed with something very simple in return. For example, the lack of iodine. And as you know, this causes problems with miscarriages and retardation. And how can Afghan women get more iodine? For those people who are watching this, why is iodine important to their diet?
Well, iodine is important to their diet because as a basic element, and in particular associated with newborn, it is greatly associated with brain development for the newborn. And the medical term for that of cretinism is something that is totally preventable, and in other areas of the world in which there have been large programs to combat that iodine deficiency, as in the United States, where salt is iodized, that's an element where somewhere in the culture of Afghanistan there has to be incorporated into the process either through salt or through flour, in which the general population can have access to that without it being looked upon as
so they have to look for fortified salt or flour to get that nutrient. But looking at it just from the scientific health perspective, in terms of breastfeeding, sometimes Afghan mothers don't know the value of breastfeeding and they end up stopping early. What would you tell them, as someone in the medical field, why breastfeeding is important?
I think the message that has to get across is that exclusively breastfeeding in the first 4 months of life has the data to support that this is the best way for the baby to survive and to thrive. Thereafter, there is a weaning period that is traditional, and depending upon what foods are available, there needs to be advice on what the local circumstances are in order to maintain a best diet for the child. But breastfeeding throughout the first year of life is certainly something to be encouraged.
And another prevalent problem is children dying from diarrhea because of the waterborne diseases, but then there's this notion that if they give them less water, it would actually cure them. And what would your message be on that topic of why
that is incorrect?
Yes.
Okay, that's definitely incorrect. The data is very, very clear associated with providing oral rehydration solutions, that is, the fortification of water with basic minerals and sugar, and that in the first year of life for the baby, that there are two messages that I would send. Number one, provide as much as the child seems to want in terms of clean water with the oral rehydration solution, and two, to continue feeding and not to get into a situation where you have a deprivation associated with feeding because they think withholding the food is helpful. Continue breastfeeding, continue access to water with oral rehydration salts in it, and continue feeding as well.
And Commander Laraby, after U.S. troops withdraw from Afghanistan, what do you think? What kind of capacity do you think your colleagues want to see within the Afghan forces?
Whatever is needed to ensure a healthy fighting force for the Afghan National Army is what we want to see. So that involves general public health principles of nutrition, of sanitation, of clean water, and so forth, for the fighting force to really make them capable.
And going back to another useful health topic for our viewers who may be watching, in terms of Afghan women who are pregnant at that stage, what are some broad advice that you could give as someone who works in this field in the U.S.?
I probably would say that there are three things. Number one, to seek out antenatal care so that you can identify whether or not your pregnancy is normal or abnormal. To have a plan to make sure that you have a skilled attendant at birth. And it doesn't necessarily have to be in a facility, but clearly in a situation where if you did develop a problem within your labor, that you are able to access a facility that can provide you the emergency obstetrical care that you need and are deserving of. And the third thing is that afterwards, that your health is going to be greatly dependent upon the spacing of children thereafter. And in fact, the health of that baby is dependent upon that as well. So there's something that you can do before the pregnancy or during the early part of the pregnancy, during your labor, and making sure that you have access to the skilled attendant and to the emergency obstetrical care, and that afterwards in preventing the next pregnancy coming too soon, so that you can adequately recover from the pregnancy as well as provide the appropriate care for the newborn.
Well, I want to thank all three of you for your time in discussing what the Department of Health and Human Services and the Department of Defense is doing with respect to helping build capacity in the healthcare sector in Afghanistan. Thank you for your time.
Thank you.
Thank you.
You're quite welcome.
A senior health official for USAID who has been to Afghanistan 4 times since 2001 when we returned.
افغانستان سفر نمودن بعد از یک وقفه کوتاه. Gary Cook
Gary Cook serves as the Senior Health Advisor for USAID's Asia Bureau, providing support for programs including family planning and reproductive health, maternal health, and children's health. USAID health programs spend over $400 million a year in this area, including support to Afghanistan, Pakistan, and Iraq. Gary, thank you for joining us.
Very nice to be here, Miriam.
I want if you could explain USAID's decision-making process in terms of identifying priorities. How do they decide what they will focus on?
That's a very easy question to answer because our approach in Afghanistan has been one to follow the lead of the Afghan leaders. And together we worked out a strategy that focused on the most vulnerable people, the women and the children, especially in the rural areas. And it didn't concentrate really on the cities and building big fancy hospitals because the vast majority of the people where the health problems were out in the countryside. So the Ministry of Health developed a strategy, and to their credit, they stuck to it, and it's something that we can support.
But there's been criticism, though, even though maybe the strategy was developed together, that when the actual contracts are awarded to the U.S. companies who help, or NGOs who help implement programs, that then it doesn't go through the Ministry of Public Health. Is this still a problem, and how is this being addressed?
Last summer, it was an agreement to transfer $236 million over the next 5 years for the ministry itself to manage and give out in contracts to local NGOs and international NGOs to deliver health services. And it just really shows the maturity of the Ministry of Health. They have ownership of this project. And we don't normally give this large amounts of money out to host governments to manage on their own unless we do an extreme amount of scrutiny. We have confidence in the accounting systems, the transparency of this contracting system. So these grants are going out to the NGOs to deliver services to people in the rural areas that need them.
Have you seen Afghan healthcare capacity grow since 2001, since you've been there a number of times?
It's just in 8 years, it's been an amazing transformation. Going from after the 30-year-long nightmare that Afghanistan knew to a time when they have actually reduced the number of child deaths. We know they've reduced the maternal mortality, and they've actually managed to arrange for basic services to be delivered to 85% of the population. Now that's compared with 9% of the population in the beginning. It's been a miraculous transformation, and it's because of the Afghanistan leadership. It's their ownership.
Of course, transportation is an issue because some patients have a hard time even getting to a facility. How do you think these transportations affect the health sector?
It's a massive problem. We know that in specific areas, very rural areas of Afghanistan, such as in Badakshan, people have to travel for days to get to a clinic. That's been much improved in the last 8 years. So have because it's been improved by setting up more clinics in rural areas. But it's also been improved by the extensive number of new roads that are out there, both the major ring road as well as the feeder roads. So people are getting around a little bit more. They're getting not only to health centers, they're getting to schools, they're getting to commercial areas.
For Afghans who may live in areas where they don't yet have a clinic, is there a way for them to make their needs known to the Ministry of Public Health or USAID to request that assistance for their village or area?
His Excellency, the Minister of Public Health, Dr. Fatemi, has said we've increased coverage from 9% to 85%, and now our next goal is to get to that 95%.
Do you see support from Congress for USAID to have the funds to be able to continue this kind of assistance until Afghanistan, of course, can get back on its feet?
There has been bilateral, bipartisan support for support to Afghanistan, especially in the health sector. Mm-hmm. We've actually received about $100 million a year to support the health sector. And we've used this to the best of our ability and tried to use it economically to show that so that more success means more success.
And in order to build a true healthcare sector, of course, the private sector also needs to get involved. Thus far, it's been government and NGO. Do you see the private sector having an increased role with respect to providing services within the country?
The private sector is very important. In Asia, about 65% of the healthcare delivered is through the private sector. And it's not surprising that that's true in Afghanistan as well. After all, Afghanistan is the creator of the Silk Road. These people know how to use the private sector. USAID has a program called Compre-A, where we work through pharmacies, and these pharmacies sell health-related products at very subsidized rates. These products include chlorine for purifying water, impregnated bed nets to prevent malaria, contraceptives, and antibiotics. And so this is a way of using the power of the private sector to get those products out there to where people can get them.
And this program exists in Afghanistan?
It does, and it's been existing for 7 years.
And the last, and of course, a very important issue is with respect to maternal and child health. Can you just provide a brief overview of what USAID is doing in this area?
Maternal and child health is the highest priority for the government of Afghanistan, and therefore it's the highest priority for USAID in the health sector. We've been helping the ministry deliver what they call the basic package of health services throughout the country. And these are the life-saving, evidence-based interventions that we know save lives. Simple things that are preventive, such as immunizations, maternal and child health care, prenatal care for pregnant women, and safe delivery. Women have an extremely high mortality rate in childbirth. Some women were quoted as saying that in Afghanistan, we keep having babies until we die. That has to stop. And there are a lot of really well-known ways that we can do this. We know that over the last several years, the maternal mortality rate has decreased a lot. And the child mortality rate has decreased 25% in just a 3-year period. I don't know of any other country where that has happened in.
Well, Gary, I want to thank you for your time, for coming and providing information to our audience about what USAID is doing in the healthcare sector.
Thank you, Miriam. It's been a pleasure.
Thank you. با تشکر از Dr. Anderson, Lawry و McCarthy.
My thanks to Drs. Laraby, Lawry, and McCarthy, and to Gary Cook for their expert thoughts and advice. For more helpful information, including the organizations you heard about tonight, just go online to americaabroad.org or visit us at tolo.tv. See you next week for another episode of Pull.
امید دیدار شما دوستان در برنامه بعدی پل. خداحافظ و شب بخیر.